So I will show you what is possible to do with a new high-frequency linear probe, because one of the targets is to improve the quality of the picture with 3D, but also with 2D. And what we can do is to increase the frequency of the probe. We know that the resolution increases with frequency. So we know it, so we have to use a high-frequency probe. But the problem is we have attenuation when you increase the frequency. So it's why we use high-frequency probe now only for the skin and superficial structure. But we can use it also for the other structure, because the development, the improvement of this probe is to focus on the penetration. When we use a classic convex probe, most of the time we use a convex around 4 megahertz probe, and this is the shape of the ultrasound beam. When we use high-frequency probe, we will use linear probe, and the steering of the beam is parallel, and we have parallel line and with a really good resolution. Also, if it's necessary, we can steer oblique here, but in this case, the resolution will be less than in this case. And you have here the same head taken with a normal probe, with a high-frequency probe linear, and with a pseudo-convex. So I tried two kinds of probe. This one, the name is 9L, but it's not 9 megahertz. In fact, it's the central frequency is 7 megahertz, and this one is 8.5 megahertz. But this one is really more difficult to use because the penetration is not so good. And the best, if you want to try, is to try on baby hairs for the resolution. And you can see here at this one at 7 megahertz, and this one at 8.5 megahertz. And this, a comparison with a convex abdominal probe, and this one with a high-definition linear probe, high frequency with abdominal scan, and this one with a transvaginal scan. So if the baby is not too far from the probe, you can have a really good resolution. You can compare to the transvaginal probe. Some examples, this is the head of the femur. This is knee joint, hairs, nasal septum, and the cord, and the conus medullaris. Look at this, it's exactly the same baby, but with convex probe, abdominal probe, 4 megahertz, and this one, you can clearly see the intestine. It's not possible to see it on it. And on this one, it was with a maximum of resolution with harmonic imaging, but it's really more clear, and we have a better tissue differentiation. Later in the pregnancy, 38 weeks, the peristaltism here on the same place with this convex probe and this linear probe. The aorta and the bifurcation on the aorta, and what is this? The two ureters. Now, conus medullaris, you had already one talk on it. This is made with a standard probe, so we can look with the standard probe. This is always, me too, at 22 weeks, I always look at the conus medullaris, and I check the position of the conus medullaris. And what I do for my screening, I don't do measurement, but I only check that the end of the conus medullaris is approximately in the middle of the two kidneys. When you move, you can move from one kidney to the other kidney. And this was made with a standard one, and this one with a 7 megahertz, and this one with a 8.5 megahertz. And you can see the difference here on this intervertebral space here. It is this one and this one. What is this? This is a nice spine, the conus medullaris, and it was obtained with 8.5 megahertz at 32 weeks of pregnancy. But this, if you want to try to obtain this kind of picture, you will never obtain it. Why? Because it's not one picture. It's only I merge 5 pictures together, because the field of the probe is not more than this. So I have to assemble to merge all these pictures. And inside, we can see the different parts. This is the central canal. And if you do a section here, you can see here the conus medullaris with the central canal here. And if you do the section here, you will have the coda echina, this part. And also, we can see here some nerves. But is it a good idea to look at the conus medullaris? Because sometimes the fetus is completely normal. You do this and you find this. What you will do, this is with a standard probe, and with this one, you have a cyst in the central canal on the lower part of the conus medullaris. But we can find it also on adults. But it's a dilatation. It's not a cyst, it's a dilatation of the end of the central canal. Now we move to the face. We can use it also for the face, and this is a face at 22 weeks of pregnancy with a different level of section, with the orbit, with maxillary, with the alveolar ridge here. And this is the posterior edge of the hard palate and the mandible. And the nose and lip at 22 weeks of pregnancy. The eyes, this is the orbit, the lens, the 2 eyelids. And look at this. We can do section inside the orbit. This section is this one. This one is a section of the lens. And what we can see here, it's the iris and pupil if you do this section. So you can see it with this kind of probe, and you will see it on a video from the orbit, lenses, pupil. And it's strange because inside it's completely dark, but the normal aspect of the fetus is meiosis during the pregnancy. This is a posterior tissue behind the orbit, and inside you can see the optic nerve. And you can follow and see the optic chiasma. How to find it? You just have to go on the Willis circle of Willis, and you just go slowly down just under this circle, and you will find here the circle of Willis with the 2 optic nerves going here, here, and crossing. Now, the heart, it's a little bit more difficult to use it because this was made with the same probe, but one is with the harmonic imaging. And if we want to improve the quality, we have to use the harmonic imaging. But it's difficult to use with this kind of probe on the heart because you have a kind of B-flow. You can see here, kind of B-flow. So for the heart, when I use it, I have to remove the harmonic imaging. And also on this view, on the 3-vessel view, here you have a nice view of the lung and the thymus, but it's not good for the visualization of the pulmonary artery and the aorta. It's better without the harmonic imaging. So thank you for your attention.